giving an information about some things which are very significant for saving. So, I am a sports surgeon at Apollo Bangalore, and this particular video is an educative video on how to save your menisci. In knee joint, there are some shock absorbers which are called as menisci. There are two of them. One on the inner side is called as the medial meniscus, and the outer side is called as the lateral meniscus. People after getting ligamentous injury or sports injuries don't treat those injuries on time, and by the time they get an MRI done, maybe 3 months, 6 months down the lane, they find that they have meniscal tears, and these meniscal tears on a large way are treated if delayed by just removing the meniscus. And meniscus is a very important shock absorber. Once it goes, knee definitely goes into an osteoarthritis over a period of 7 years and above. So, what is the present strategy is repair as much as possible the menisci when it is. So, suppose for example, if you have certain patterns of tear along the axis of the menisci, then these kind of tears can be repaired and stitched back, and if it heals, it gives you a perfectly normal function for a whole life. That it prevents the damage to the cartilage, which is depicted in this model as an yellow color. This is the cartilage, and this cartilage is protected by the menisci, which is shown in the white color here. This cartilage protection comes from menisci, so this menisci needs to be stitched up. There are various types of repairing the menisci which are on the back side of the knee. This is called the posterior third. We use a technique called all inside techniques for suturing or meniscus root repairs. If it is in the middle third and in the front third, we can stitch it back by inside out technique, and in the front we do what is called as outside in technique. So, these all techniques that we are available here. So, in today's scenario, what we do is any kind of meniscal tear except for some which comes into the innermost area, that is any. So, if you say 100 cases, we need to remove the menisci in less than 5% of cases. All other cases we are able to stitch them back, and we see that also 80% of them go into complete healing also. So, it is one of the most important ways to prevent onset of osteoarthritis after any kind of knee surgery. Earlier we used to have no other technologies but to just remove the menisci off. Today we can stitch it back using various techniques.